Well, researchers have found that nearly half of Americans have diabetes or prediabetes, and now a revolutionary treatment has made its way to the Lake area thanks to Trina Health. Dr. Phillip Conner is here to tell us what this treatment option is and how it works. Thanks for coming in.
Thank you very much.
And I think all of us know someone who has diabetes, and it seems like it's just a lifelong struggle, and this is something that can help with a lot of the problems people encounter.
Without a doubt, and for so long we've been limited in our treatment options. Most of the time we utilize insulin or insulin surrogates to try and mimic what the body normally does. And Trina's been able to more closely track along with what the body wants to do in sugar metabolism, and by doing that we see pretty good outcomes.
All right, well, Trina has this new option for people that are having some issues. Tell us what it is and how it works.
Sure. About 25 years ago, researchers noted that the insulin is released in a very quick or pulsatile manner in response to food or glucose. So what they've been able to do is mimic that process in people that are diabetic in an effort to utilize the mechanisms that are already present to let the body do what it wants to do, which is metabolize the sugar in a very efficient manner. The old ways were very heavy-handed. Use high doses of insulin in an effort to overwhelm the body. This is much more elegant and much more efficient.
Okay, so people come in now once a week to get this treatment, and what is it doing in their bodies?
Well, it's a combination. So whenever they come in, they get a glucose load, and then it's mixed with a pulsatile release of insulin. That is mimicking what the body normally happens in a non-diabetic in the presence of sugar. When that happens, that signals the liver to process that sugar very quickly in the mechanisms that are already present. Over time, that constant stimulation of that process reinforces itself, and the body is able to get rid of the excess sugar.
Okay, and this isn't something that's going to replace your regular treatment. This is something that you're adding to your regular treatments that you're already doing. But you're seeing some tremendous results in people that have some of those basic complications, things like neuropathy and non-healing wounds and retinopathy.
Dramatic. One of the most difficult things to treat in diabetics is neuropathy. It is incredibly painful and is a significant impact on quality of life. But even within the last month with the treatments, many of the patients that we see begin to see dramatic improvements where they begin to have feeling back, begin to have strength back in their lower extremities where before they didn't have any. In addition to the wound healing, I think it's through the increased efficiency of the treatment of the diabetes, the healing process speeds up significantly. So
should people wait until they have a big issue before they come to Trina Health, or should this be open to anyone who is, dealing with diabetes?
Yeah, it's open to anyone. I think all of us would recognize that the natural mechanisms are much superior to the artificial drugs that we can externally administer.
Okay.
So it is a time commitment. It's 4 hours once a week for the first 12 weeks. And after that time, generally the improvements are present. So it's kind of a motivating factor to continue.
Okay, and of course you can call Trina Health. You see the number there on the screen. Give them a call and make an appointment so that you can find out how this might help you when you're dealing with diabetes. Thank you so much for coming in.
Thank
It's
you
very
much.
Interesting.
Thank you.
Well, stay with us. We're going